Looking at several studies, there are underlying themes. The first is that rehabilitation following COVID 19 can be extremely beneficial. This can be predicted, especially in aging populations, because of the known outcome of resistance training to reduce sarcopenia in older adults. Sarcopenia becomes prevalent with decreased resistance training. However, it models the effects of COVID's havoc on the human body. Due to COVID's newness in the world, there are not many studies in the long-term effects of rehab following infection, mainly because we're only 3 years out of the first case of COVID-19 in the U.S. This is going to take 10 plus years to see the actual long-term effects of long COVID. Another name for long-term effects is long COVID. A common consensus of the studies found were that a large portion of patients following COVID-19 infection continued experiencing symptoms in the following 3 to 12 months. In a research study examining the overall effects of rehab after COVID, it found that exercise was not only a beneficial factor in increasing cardiovascular functioning and reducing dyspnea, exercising also helped the mental component of COVID, which we've seen to be a huge part of COVID-19 and the psychological effects that you see with COVID. While researchers could have assumed this, it is helpful to understand that some movement during infection and post-infection can be more beneficial than none. Another research article examines the efficacy of a cardiopulmonary recovery plan of patients from the same hospital. This specifically looked at patients with the same symptoms on the same floor. This study was interesting because it looked at patients who came into the hospital with an okay cardiovascular base prior to COVID. Okay means that these patients weren't necessarily running 5 miles or a 5K or a half marathon, but they weren't necessarily just sitting on the couch all day. They just experienced an okay cardiovascular base. Improvements were observed in the 6-minute walk test, as well as improvements in the ventilation status. Now, reading this as an outsider, my first thought was, that could just be because they weren't super active before doing the research study and before COVID, and now that they're in the hospital and they are experiencing all of these symptoms and they need the rehab, now they're seeing improvements. But researchers also concluded that regardless of previous ventilation status in patients, there were some improvements. Another study that I examined, just one of the last studies that I looked at prone positioning patients as a therapy in patients that were ventilated with ARDS. And while it was interesting, more research is needed to see if prone positioning is an actual factor in rehab.